Bet you're getting tired standing up all this time. OxyContin, 3 OxyContin a day, 4 Percocet a day, 3 Soma a day, 3 Ambien a day, 4 Adderall a day, which is stimulant used because the person was fatigued, pack of cigarettes per day, pint of vodka a day, marijuana, a gram or 2 medically prescribed, and finally a gram of heroin a day. These were the medications and substances that 28-year-old Alicia was taking. Alicia was admitted to Las Vegas Recovery Center, but over the last 8 years she had developed this serious addiction. Her history was at the age of 7 she was molested sexually. She developed painful menstrual cramps at age 13, 14, and she went to the doctor who promptly prescribed Lortabs. Around 14 and a half, she started smoking marijuana and drinking alcohol. Her mom was alcoholic. When Alicia was 16 and a half, her mom died of cirrhosis of the liver. Alicia was date raped at age 17 under the influence. 20, she and her boyfriend were driving in a car. They were in a head-on collision. They were both intoxicated. When she awoke from her coma 2 days later, he had been killed. At the age of 22, Alicia was diagnosed with fibromyalgia, chronic painful condition, and her pain levels were about 7 or 8 out of 10 for the rest of her days, despite the medication she was taking. When she was 25, she was arrested, and she was referred to drug court. Dr. Kearns, he thinks he's a doctor sometimes, but Judge Kearns' court. And she did very well for 3 months. She stayed clean, she started going to meetings, she did some treatment, and one day she showed up in his court, high as a kite. I asked her later when I met her, what were you thinking? She said, I thought he wouldn't notice. She was literally drooling in her shoes. She went to jail. She got out of jail. She continued to use. She was a single mom of 2 kids. She had trouble getting to work and caring for her kids, so her sister was enlisted to help out. And finally, her sister had had enough. Her sister called Child Protective Services because Alicia was driving under the influence with her 2 young children in the car. Confronted with losing her kids, returning to jail, and the words that her sister uttered, "You're worse than our mother ever was," Alicia was convinced to come to treatment. Well, she didn't skip into treatment. She didn't wake up that morning and say, goody, I get to go to treatment and stop everything. And when she found out that she was not only going to come off heroin and marijuana and alcohol, but also all the prescription drugs that she was on, she kind of hit the roof. And I got the brunt of that. She was very angry. As many people do, she went through a very tough detox. She couldn't sleep for 3 weeks. Her pain increased temporarily, but then as we see very often, when the opiates were cleared of her system about a week later, her pain started to drop. One of the key components that she had to deal with was the multiple traumas that she had experienced. She dealt with her grief, her anger, her anxiety, and she developed a willingness to change her perceptions, her attitudes, and her actions. And she started to trust. She learned about the 12 steps, about healthy nutrition and a good approach to dealing with the past. She learned about mindfulness meditation and started to meditate. She got sponsored. And after 35 days in treatment with us, she went to a halfway house for 3 months. Fast forward 15 months later, she's clean of all drugs, she has her kids back, she's at a new and better job, she's less depressed, she's sleeping better, she goes to meetings, she has a sponsor, and she sponsors other women. So several conclusions about Alicia, who's a good example of the disease of addiction. She has addiction, and it's a stigmatized disease. And one of the main reasons it's stigmatized is she did bad things. She drove under intoxication with children in the car. And it's really hard not to judge her for those behaviors. She had suffered significant trauma in her life, and this contributed to the way she ended up later in life. She lost the genetic lottery. She had an alcoholic mother, and her dad was a heroin addict. She was exposed early in life to multiple drugs, nicotine, marijuana, alcohol, and then painkillers, and eventually she became hooked on heroin, a very common pattern. She was trying to ablate her emotional pain and her physical pain. Inadvertently, without her realizing it, the drug became number 1, developed survival salience, which is the result of the brain becoming rewired. It started at an early age because of exposure to the drug. She was vulnerable because of her genetics and the experiences of trauma. Drugs became more important to her than work, her ethics, avoiding jail, and taking care of her children. She experienced the bottom. It was brought to her, in essence. And finally, at the thought of losing her kids and being incarcerated, she came into a willingness of sorts to change her life. Today, she's practicing what we call recovery, an ongoing maintenance program. And this is a good news story. People don't have to die from the disease of addiction. I want to spend a couple of minutes talking about the opioid epidemic, because opioids are the medication that really we are treating mostly at Las Vegas Recovery Center. We see all drugs, but it's this opioid epidemic that is at the head of what's happening in our culture. We Americans have 4% of the world's population, and we consume 80% of the world's opioids. 9 million Americans are on daily opioids in the United States. That's 250 million doses a year, which has doubled in the last 10 years. 5 million use opioids non-medically or recreationally. Kids are using opioids. It's the #1 new drug for 12 years and up young people, more than marijuana last year. My colleagues, my physician colleagues, write enough medication to give every adult in the United States Vicodin every 4 hours per month. There are 22,000 deaths, consequently, every year. More than motor vehicle accidents, more than cocaine and heroin overdoses combined. What's this about? Partly it's about profit. The OxyContin industry is greater than $2 billion a year. If you add the other opioids, we're well over $12 billion. And then comes heroin, which is a natural outgrowth of the prescription drugs because it's cheaper, it's readily available, and it's more potent. Heroin deaths and use have doubled in the last 6 years. So we have a serious problem in our community. You have a serious problem in your community. Adolescents, they feel bulletproof. They're struggling with low self-esteem, they're trying to fit in, and then they discover nicotine, they discover alcohol, they discover marijuana, they start with pain pills which get the ball rolling, and now we have an epidemic, a new epidemic of heroin. What effect will legalizing marijuana in many states and decriminalizing in others and legalizing medical marijuana in our wonderful state? We've decided that we're going to open dispensaries like many states have in the country, and you all probably, you ought to know that it's going in the front door by prescription, it's going out the door to our young people. We have data that says that marijuana, I guess it's almost time. Yes, I hear you. Marijuana damages young brains, decreases IQ. What about the war on drugs? Is that effective? Absolutely not. Suboxone, methadone, dependent drugs that are going to stabilize people's lives, is that the solution? I don't know. I don't know exactly what to do about this problem, and I suspect you don't either. But I do know that we have to start early. We have to start not in middle school. We have to start in elementary school and preschool, and those kids are coming to your libraries. I have a special fondness for librarians. My partner was a librarian, and I was on the Clark County, Las Vegas Library Board for 9 years. 9 long years. It was a number of years ago, but I know a lot about what librarians do and your dedication to public information, educating people, and helping them find resources. You are community representatives and leaders, you're educators and mentors, and you can steer people towards the proper resources and information about addiction, about opioids, and about pain. I also know that too many of our young people are dying. They're getting hooked on serious drugs like heroin. Let's start tonight and take this back to your community so that we don't have to bury any more of our kids. Thank you very much.